stop. Look at your fingernails right now. Because what you're about to ignore could be the only early warning sign your body gives you. There are people who had no pain, no symptoms, nothing unusual at all, until a small change on their nails revealed something much more serious: cancer, liver disease, severe anemia. Not later, not when it was obvious, but weeks, sometimes months before anything else showed up. And here is the part most people don't realize. By the time symptoms appear, you are already late. So the question is not whether your body is sending signals. It already is. The real question is, are you missing them? My name is Dr. Michael Cotter. For over 10 years, I have worked with patients whose bodies were giving clear signals long before any diagnosis was made. What surprises most people is not how diseases develop, but how early the body starts showing signs that something is wrong. And one of the most overlooked places those signals appear is right at the tips of your fingers. Your nails are not just cosmetic. They are part of a living system that reflects what is happening inside your body. They respond to stress, to deficiencies, to changes in circulation and metabolism. In many cases, they begin to change months before you feel any symptoms at all. The problem is not that the signs are hidden. The problem is that most people do not know how to recognize them. A slight change in color gets ignored. A line or ridge gets dismissed. Patterns that would raise concern in a clinical setting are often overlooked in everyday life. And that gap between what your body is showing and what you understand can make a real difference. In this video, I am going to walk you through the most important signs your nails can reveal about your health. Some of these are harmless, others can point to serious conditions that need attention, and once you understand what to look for, you will start seeing your hands in a completely different way. I have seen too many people wish they had known this earlier. Now you have the chance to know. What makes your nails so powerful is not how they look, but where they come from. Every nail on your hand is formed in a small area of living tissue called the nail matrix. It sits just beneath the skin at the base of your nail, and it is highly sensitive to what is happening inside your body. Any disruption, whether it is related to nutrition, circulation, metabolism, or inflammation, can influence how that matrix produces the nail you see. And here is what most people never realize. Your nails are not just growing in real time. They are recording history. On average, a fingernail takes about 4 to 6 months to fully grow from base to tip. That means what you are looking at right now is not just a reflection of your current health, but a timeline of what your body has been through over the past several months. Every ridge, every discoloration, every subtle change is a marker left behind during that process. Think of your nails like a black box in an aircraft. They continuously capture data even when everything seems normal. And when something goes wrong, that record is already there, waiting to be read. The structure of the nail itself also tells an important story. About 90% of the nail plate is made of keratin, a strong structural protein. But unlike hair, which is flexible, the keratin in your nails is arranged in tightly bonded layers. These layers are reinforced by chemical bonds that depend on proper nutrition, especially sulfur-containing compounds, as well as adequate hydration and circulation. When your body is functioning well, those layers form smoothly. The nail appears even slightly glossy and resilient. But when something is off, even slightly, the structure begins to change. The surface may become rough, the color may shift, the growth pattern may slow down or become irregular, and these changes often happen long before you feel anything wrong. For example, when your body is low on certain nutrients, it will prioritize essential organs first: your brain, your heart, your lungs. Peripheral tissues like your nails are not a priority, so they are often the first place where subtle deficiencies begin to show. Not because they are unimportant, but because they are expendable in the short term. The same applies to oxygen levels in your blood, changes in circulation, and even chronic stress. All of these factors can alter how the nail matrix functions, and those alterations become visible over time. So when you look at your nails, you are not just seeing a surface, you are looking at a delayed reflection of your internal state. The only question is whether you know how to interpret what you see. One of the most common things people notice on their nails is a small white spot. Almost everyone has heard the same explanation at some point. It means you are low on calcium. That idea has been repeated for decades, but it is simply not true. Those white spots, known medically as leukonychia, are not caused by a lack of calcium. What you are actually seeing are tiny air pockets trapped within the layers of the nail as it forms, and in most cases they come from minor trauma to the nail matrix. You may have hit your finger without thinking about it. You may have pushed your cuticle back too aggressively. The impact was small, you forgot about it, but the nail recorded it. Weeks later, sometimes even months later, that spot becomes visible as the nail grows out. By then, the cause is long gone, and all that remains is the mark. So in most cases, a small white dot is harmless. But this is where things become important. Not all white marks are the same. If instead of small dots, you begin to see horizontal white lines running across the nail, especially on multiple fingers at the same time, that is something entirely different. These lines can be associated with more serious underlying issues, including problems with kidney function, significant protein deficiency, or exposure to certain toxins. At a glance, they may look similar, but the meaning behind them is not. This is the pattern you will start to notice as we go deeper. Small visual differences can represent very different biological processes. Now let's move to something even more revealing: the overall color of your nails. A healthy nail is usually light pink. That color comes from the blood flowing through the tiny vessels beneath the nail bed. So when the color changes, it often reflects changes in your blood, your oxygen levels, or your internal systems. If your nails start to appear pale, almost white, it may indicate that your body is not carrying enough healthy red blood cells. This is commonly seen in anemia, where oxygen delivery throughout the body becomes less efficient. On the other hand, if you notice a bluish or gray tone, that can point to something more urgent. It may suggest that your blood is not getting enough oxygen. This can happen in conditions that affect the lungs or the heart, where oxygen exchange is impaired. And this is not something to ignore, because when oxygen levels drop, your body does not always send clear warning signs right away. But your nails may show it. Yellow discoloration is another common change, especially as people get older. In many cases, it is caused by a fungal infection that develops under the nail. The nail may become thicker, more brittle, and lose its normal shine. But sometimes, yellow nails are not just a surface issue. When multiple nails change color at the same time and begin to grow more slowly, it can point to deeper systemic problems, including issues with the lymphatic system. So again, the appearance may seem minor, but the meaning can be much bigger. And this is only the beginning of what nail color can reveal. There is one nail change that matters more than almost anything else we have discussed so far. And this is the one you cannot afford to ignore. A dark vertical line running from the base of the nail to the tip. At first glance, it may not seem alarming. In many cases, especially in people with darker skin tones, this can be a normal pigmentation change. But there is a specific situation where that line becomes a warning sign for something far more serious. A rare but aggressive form of skin cancer can develop underneath the nail. It is called melanoma, and in its early stages, it often appears as a narrow dark stripe. The danger is not just the condition itself. The danger is how easy it is to dismiss. Because it looks simple, it looks harmless, and for a long time it may not cause any pain at all. But there are specific features you need to pay attention to. If that dark line is wider than a few millimeters, if the edges are not clearly defined, if the color is uneven or changing over time, or if the pigment begins to spread onto the surrounding skin, those are warning signs that require immediate evaluation, not next month. Not when it becomes uncomfortable. Immediately. Because with conditions like this, timing is everything. Early detection can make a critical difference. Waiting can cost you that opportunity. Now, let's shift from color to shape because shape changes can be just as revealing. If you look at your nails from the side, a healthy nail has a gentle outward curve. It is subtle, but it is consistent. When that shape changes, it often reflects a deeper issue. If the nail begins to curve inward, creating a shallow dip in the center, almost like a small spoon that is known as spooning. This is commonly associated with iron deficiency. When your body does not have enough iron, it cannot maintain the structural integrity of the nail, and that change becomes visible. What makes this important is that it can appear before standard blood tests show a clear deficiency. Your body prioritizes essential functions first, so early signs often appear in peripheral tissues like the nails. On the opposite end, if the nails become more rounded and the fingertips appear thicker, almost swollen, that is a condition known as clubbing. This is something clinicians recognize immediately because it is strongly associated with serious underlying conditions, particularly those affecting the lungs and the heart. Chronic lung disease, certain cardiovascular conditions, and even some forms of cancer can lead to this kind of change over time. There is a simple way to check for this at home. Place the same fingers from each hand against each other, nail to nail, and look at the space between them. Normally, there is a small gap, a diamond-shaped opening. If that gap disappears and the nails press flat against each other, it may be a sign worth investigating further. It takes only a few seconds to check, but it can reveal something significant. And just like with color, these shape changes are not random. They are responses, signals, adjustments your body is making under the surface. The key is knowing when those signals are normal and when they are not. Beyond color and shape, the surface of your nails carries another layer of information that most people never pay attention to. If you look closely under good lighting, you may notice thin vertical lines running from the base of the nail to the tip. In many cases, especially as people get older, these ridges are completely normal. They develop gradually over time as the nail matrix becomes less consistent in how it produces new cells. But context matters. If these ridges appear suddenly, or if they become much more pronounced over a short period of time, that can point to something else. It may indicate a deficiency in certain vitamins, particularly those involved in cell regeneration, or it may reflect changes in how your body is absorbing nutrients. Now compare that to horizontal grooves that run across the nail from one side to the other. These are very different. These lines form when nail growth is temporarily disrupted. A serious illness, a high fever, a major stress event, or even surgery can cause the body to redirect its resources away from nail production. When that happens, the nail pauses, and when it resumes, it leaves behind a visible mark. What is remarkable is that these lines can actually help you estimate when that disruption occurred. Because nails grow at a relatively steady rate, the position of the line on the nail can give you a rough timeline of when your body went through that stress. In a way, your nails are recording events you may have already forgotten. Another surface change to watch for is small, scattered indentations across the nail, almost like tiny pinpoints. These are known as pitting. While they may seem minor, they are often associated with conditions where the immune system begins to affect the skin and related structures. And in some cases, these nail changes can appear long before other symptoms become visible. Now let's shift slightly outward to the skin around the nail. Those small tears of skin that appear at the edges of your nails, often called hangnails, are usually dismissed as a minor annoyance. But when they occur frequently, especially with no obvious cause, they can reflect something deeper. Nutrient imbalances, particularly involving trace elements that support skin integrity, can make this area more prone to damage and slower to heal. Persistent redness, swelling, or tenderness around multiple nails is also something to pay attention to. Occasional irritation happens, but when inflammation becomes chronic, it may indicate that your immune system is reacting in ways it should not. And finally, we need to talk about your feet. Most people rarely examine their toenails closely, but they can reveal important information, especially about circulation. Toenails grow more slowly than fingernails, and they are more affected by blood flow. When circulation is reduced, nails can become thicker, more brittle, and change in color. In some cases, they may begin to deform over time. There is a simple check you can do. Press gently on the nail of your big toe until it turns pale, then release. The color should return within a couple of seconds. If it takes noticeably longer, it may suggest that blood flow to that area is not optimal. This is not about creating fear, it is about awareness. Because the more familiar you become with these small details, the easier it becomes to recognize when something is not right. At this point, you might be thinking, there is a lot to remember. Different colors, shapes, textures, and signals, and that is completely fair. So instead of trying to memorize everything, I want to give you a simple system you can actually use. Something practical, something you can do in just a few minutes each week. Think of this as a 5-minute check that can help you stay aware of what your body is showing you over time. Start with lighting. This matters more than most people realize. Natural daylight is best because artificial lighting can distort color. Subtle changes, especially early ones, are easy to miss under indoor light. Take a moment near a window and look at your nails clearly. Next, look at the color across all your nails, not just one. You are looking for consistency. Are they evenly pink, or do you notice areas that look pale yellow or slightly blue or gray? Changes across multiple nails often carry more meaning than a single isolated difference. Then move to shape. Look at your nails from the side. Is the curve smooth and natural, or has it changed? You can also use the simple finger test we talked about earlier. It takes only a few seconds, but it can give you a useful reference point. After that, pay attention to the surface. Run your finger lightly across each nail. Notice if it feels smooth or if there are ridges, grooves, or small indentations that were not there before. What matters most is not perfection, but change over time. Now, shift your focus to the skin around the nail. Look for redness, swelling, or areas that seem irritated. Occasional issues are normal, but patterns that repeat or do not heal are worth noting. And finally, do not forget your feet. Take a moment to check your toenails in good light. Look at thickness, color, and overall condition. If you want to go one step further, use the simple circulation check by pressing on the nail and observing how quickly the color returns. One more thing that can make a big difference. Take a photo once a month. It may seem unnecessary, but over time, it gives you a visual record. Small changes are often hard to notice day to day, but when you compare images over several months, patterns become much clearer. This is not about diagnosing yourself. It is about becoming aware, because when you are familiar with what is normal for your body, you are much more likely to notice when something changes, and that awareness can be more valuable than you think. What you have just seen is not something complicated, and it is not something hidden from you. In fact, it is something your body has been showing you quietly for a long time. Your nails are not random. They reflect patterns, changes, and signals from inside your body, often earlier than anything you can feel. And in my experience, what surprises people the most is not how complex the body is, but how often it gives early warnings that go completely unnoticed. Personally, I have seen too many cases where small signs were present long before a diagnosis was made. Not dramatic symptoms, not pain, just subtle changes that did not seem important at the time. And by the time those signs were taken seriously, the situation had already progressed further than it needed to. That is why awareness matters. Not to create fear and not to make you overanalyze every detail, but to help you recognize when something changes in a way that deserves attention. Because your body rarely starts with something obvious, it usually starts small. And now you understand what some of those small signals can look like. At the same time, it is important to be clear about this. This video is not a diagnosis and it is not a replacement for professional medical care. Nail changes can have many causes, and not every sign means something serious. If you notice something unusual, persistent, or concerning, the right step is to have it evaluated by a qualified medical professional. What this gives you is awareness, a way to notice earlier, to ask better questions, and to take action at the right time. If there is one habit I would recommend, it is this. Take a few minutes each week to actually look. Good light, no distractions, just observe. Over time, you will begin to recognize what is normal for you, and that makes any change easier to catch. And if this video helped you see your own body differently, share it with someone you care about. A parent, a friend, someone who might ignore a small sign today that could matter later. You might be helping them notice something that makes a real difference. And if you want to learn more about how your body signals problems before they become serious, subscribe to the channel. I am Dr. Michael Carter, and I will continue to share what most people overlook so you can act earlier and with more confidence.